Hi guys, my name is Haley Potts and today I'm going to be giving a presentation over the respiratory system. I'm going to be talking about the function of the respiratory system, the anatomy, and the effects of aging. I also chose to pick asthma as my age-related condition, and I'll be talking about an intervention that I researched later on in the presentation. So first, I'm going to be talking about the anatomy of the respiratory system. So the respiratory system is pretty simple. It is a network of tissues and organs that help you breathe. So let's start with the anatomy of the airways. So your airways are what deliver air to your lungs. So we have the mouth and the nose, we have the sinuses, the pharynx, trachea, and the bronchial tubes. So the function of each of these things goes like this. Your mouth and your nose are openings that bring air from outside of your body into your respiratory system. Your sinuses are hollow areas in between the bones in your head that help regulate temperature and the humidity of the air that you inhale. Your pharynx delivers air or oxygen, air to your nose and your mouth to your trachea. Your trachea, also known as your windpipe, is a passage that connects your throat and your lungs. And then you have your bronchial tubes, which are pretty simple. They're the tubes that connect your windpipe to each of the lung. So from your lungs, your bloodstream delivers oxygen to all your organs and your tissues. And just like any other system, you also have muscles and bones that are a part of your respiratory system and the anatomy of it. So muscles of your respiratory system are your diaphragm. So your diaphragm helps move the air you inhale into and out of your lungs. You also have bones in your respiratory system. You have which are called your ribs. So your ribs protect and surround your lungs and your heart. A few other things that I want to mention for the anatomy of your respiratory system are your alveoli, your bronchioles, your capillaries, and your pleura. All of these things work with your lungs and your blood vessels. Your alveoli are tiny air sacs in the lungs where the exchange of oxygen and carbon dioxide take place. This is where it happens, is in your alveoli. Your bronchioles are small branches of your bronchial tubes that lead to the alveoli. Then you have your capillaries. We all know capillaries are blood vessels in the alveoli walls that move oxygen and carbon dioxide. And then lastly, you have your pleura, which is a thin sacs that surround each lung lobe, and it also separates your lungs from your chest walls. So moving on to the function, all of these things in your system help your body absorb oxygen from the air so your organs can work. It also eliminates waste gases such as carbon dioxide from your blood. Now, how does a healthy and normal respiratory system function? Well, this is very easy. Some of the functions of a healthy respiratory system include allows you to talk and smell. We all know this. It helps match your warm air. It regulates warm air to match your body temperature. It delivers oxygen to the cells of your body, and it protects your airways, your mouth, your nose, trachea, pharynx, bronchial tubes. It protects those things in your airways from harmful substances and irritants. Now, let's move on to the effects of aging that the respiratory system, let's move on to the effects of aging of the respiratory system. Sorry, I'm a little nervous. So, the effects of aging, just like any other body system, your muscles tend to get weaker as you age. So, your respiratory muscles become weaker, your diaphragm becomes weaker. This decreases the ability to inhale and exhale, which is a really big problem. Also, your alveoli, which are the tiny air sacs where the oxygen and carbon dioxide exchange takes place, can lose their shape and become baggy. So all of these things lead to potential outcomes. All of these changes do. They increase the risk for respiratory infections and disorders. We have disorders such as bronchitis, asthma, pneumonia, COPD, and so forth. And that leads me into the age-related condition that I chose to pick for the respiratory system. I chose asthma. So I wrote a little thing about asthma here that I want to read to you all. It says, due to the natural aging process, elderly individuals are at a greater risk for developing the condition asthma because of the poor respiratory muscle strength, the decreased inelastic recoil, and the greater rigidity of the chest wall. So, during asthma, your airways become swollen and inflamed with mucus, and normal airways are not supposed to do that. So asthma really is the chronic inflammation of your respiratory tubes. It's the obstruction of your airways from inflammation. So the etiology of asthma is unknown, but there's a combination of environmental factors and inherited factors that could lead to asthma. The pathology of asthma, I just mentioned, it's the chronic inflammation of the respiratory tubes. Some signs and symptoms of asthma are wheezing when coughing, wheezing when inhaling, chest pain, chest tightness, shortness of breath, all of these things. Medical management of asthma is pretty simple. We all know inhalers, inhaled corticosteroids, antihistamines such as Benadryl, Aleve, and one of the big things that you have to manage with asthma is you have to avoid triggers. For example, smoking. You have to avoid these triggers that could cause a flare-up or inflammation to happen. So the ICF model here that I wrote down for asthma is also pretty simple. The disease, asthma, the body functions and structures, which are the impairments. Again, the airways are obstructed. They're inflamed, so the airways are not working properly. That's going to impair you in a lot of ways, because remember, your airways are made up of a lot of significant things in your body: your mouth, your nose, your sinuses. They're all a collection of things that help you breathe. So if they're obstructed and inflamed, you cannot breathe properly. So that's an impairment for sure. The activity limitations. I mean, some of the activity limitations are things that people without asthma take for granted, like walking and exercising and being around people, social gatherings. This also restricts participations in these things. Walking up a flight of stairs, strenuous exercises, and you can't enjoy big crowds anymore, like a party or a concert or even social gatherings with your family. The room gets thick, the humidity gets hot. I mean, it causes flare-ups to be in a big room full of people like that. So those are the participation restrictions of asthma. Some environmental factors that can cause asthma: obviously smoking, air pollution, and a big thing right now is climate change. The seasons change, obviously, and going into spring, we have a lot of pollen. A lot of asthmatic people I know are carrying their inhalers more frequently. They're having trouble breathing this year with the pollen and the climate change, and developing more serious conditions. Like I have an asthmatic friend that has developed pleurisy, which is a inflammation of your pleural cavity. Again, another respiratory kind of disorder. And some personal factors that can affect that cause an effect for asthma are it affects your mood. I mean, think about not being able to walk up a flight of stairs without getting out of breath. Think about not being able to enjoy a concert or like a social gathering or a party that you've been wanting to go to. I mean, it affects your mood, your confidence, your coping mechanism. These are personal factors that affect you when you have asthma. I mean, anxiety, stress, those two things can cause flare-ups. So these are real problems with people that have asthma. So I know we've talked about the negative side effects of asthma, obviously, but a positive thing that I discovered when researching for the PT intervention for asthma is you can do yoga. So I know that's an unconventional way. I didn't really know much about it either. Below I attached my summary and the articles that I used to kind of come up with this opinion about yoga that I have. And I think that it is a wonderful treatment for asthma. I mean, let me just read you a few facts about it. So yoga intervention for asthma, it's basically training you to rebreathe. It's a rebreathing therapy. This increases the compliance of the lungs and improves cellular respiration by increasing oxygen delivery. And doing yoga, the posture of doing yoga, it readjusts the autonomic imbalance and increases respiratory efficiency. These are really positive outcomes, and I encourage you to read below the summary that I wrote and the articles that I looked up for this intervention. So that's it, guys. That's my presentation over the respiratory system, you know, how the anatomy, how it works, the important parts about it, the normal functions, the age-related conditions, the increased risk, the potential outcomes, and asthma. So I will leave you with these 2 questions. So the first question is, what can you do now to prevent yourself from developing these respiratory infections and disorders such as bronchitis, asthma, COPD, pneumonia? What are some preventative measures you can take now to avoid these things from happening to you? And then the second question, I just want to know what are like 3 things that you learned that you didn't already know about the respiratory system today? Because when I was researching and looking up all these things, I didn't even know half. So I would like to know 3 things that you learned today during my presentation. Thank you so much for listening, and have a blessed day. Thank you.